This video will cover the following objective: identify and describe the major anatomical areas of the heart, chambers, valves, and greater vessels. Blood flows through veins into the superior chambers of the heart called the atria. We'll start by focusing in here on the right atrium. The right atrium receives deoxygenated blood coming from the systemic circuit. So this blood has delivered oxygen to cells and tissues all throughout the body. The inferior vena cava is draining deoxygenated blood from the lower limbs as well as the abdominal pelvic cavity, whereas the upper regions of the body, the head and the upper limbs, are draining blood in through the superior vena cava. Blood also drains from the coronary circuit, supplying the muscle of the heart wall. Cardiac veins, like this great cardiac vein or this small cardiac vein. Blood from the right atrium then moves down into the right ventricle. The right ventricle receives the deoxygenated blood from the right atrium and pumps this blood out into the artery known as the pulmonary trunk. The pulmonary trunk then branches into the left pulmonary artery and the right pulmonary artery. The left pulmonary artery is carrying this blood to the left lung, whereas the right pulmonary artery carries this blood to the right lung. Inside of the lungs, there are small blood vessels known as the pulmonary capillaries where gas exchange occurs. I switched from blue to red to represent oxygenated blood coming from the lungs into the left atrium. The left pulmonary veins are draining blood from the left lung, and right pulmonary veins are draining blood from the right lung. Then left atrium pumps blood down into the left ventricle. The left ventricle pumps blood out into the aorta. The superior region is the base of the heart, and the apex of the heart is pointing off inferiorly and to the left side. We can see the coronary sinus, which drains deoxygenated blood from the coronary circuit into the right atrium. The inferior vena cava, the superior vena cava, and the coronary sinus are the veins that return deoxygenated blood to the right atrium. Blood flows from the right atrium down into the right ventricle and then into the pulmonary trunk to the lungs, where it becomes oxygenated. Oxygen-rich blood flows back through pulmonary veins into the left atrium, then into the left ventricle, out into the aorta. The aorta will branch to numerous smaller blood vessels that distribute oxygen-rich blood throughout the body. The auricle of the left atrium is a flap-like outer portion that allows the atria to expand. The adipose tissue as well as the arteries and veins are found within these grooves on the surface. We call this the posterior interventricular sulcus. This groove in between the atria and the ventricles that contains the coronary sinus is called the coronary sulcus. And because it is separating the atria from the ventricles, it is also sometimes referred to as the atrioventricular groove or atrioventricular sulcus. A groove on the anterior of the heart here, located in between the left and right ventricles, known as the anterior interventricular sulcus. Contains the great cardiac vein as well as the anterior interventricular artery. Ligamentum arteriosum, connecting between the pulmonary trunk and the arch of the aorta, is a remnant from a structure known as the ductus arteriosus. In the fetal circulation, the lungs are not functioning for gas exchange. The ductus arteriosus would allow blood to be shunted from the pulmonary trunk into the aorta to bypass the lungs and go directly into the systemic circuit. Here we see there are muscular ridges within the atria called pectinate muscles. There's also muscular ridges on the inner surface of the ventricles called trabeculae carneae. The papillary muscles look somewhat similar, however, they're attached to heart valves. Here we can see the papillary muscles and the trabeculae carneae. The papillary muscles are a little bit more prominent and also attached to the chordae tendineae. When the ventricle contracts, the papillary muscles also contract, placing tension on the chordae tendineae, which helps to reinforce the AV valve, preventing regurgitation, the valve being forced backwards. There's two AV valves. The right AV valve is the tricuspid valve, which prevents blood from flowing backward from the right ventricle into the right atrium. The left AV valve, labeled bicuspid, is commonly referred to as the mitral valve. The mitral valve prevents blood from flowing backwards from the left ventricle into the left atrium. When the ventricles contract, the pressure of blood inside of the ventricles forces the AV valves closed, and blood is forced out of the ventricles into the arteries. There are also valves that prevent blood from flowing backwards into the ventricles from the arteries when the ventricles relax. These are what we call the semilunar valves. We commonly just abbreviate SL. Here's the aortic semilunar valve. As the left ventricle relaxes and there's a lower pressure in the left ventricle than the aorta, the blood in the aorta pushes back on the flaps of the aortic valve, causing those flaps to be pushed closed. Those flaps have a crescent shape like the moon, and there's 3 of those crescent-shaped flaps that push closed to prevent backward flow. With this illustration, we can see the pulmonary semilunar valve functions to prevent blood from flowing backwards into the right ventricle. Another structure we can see here is the interventricular septum, this muscular wall separating the right and the left ventricles. Fossa ovalis, oval shaped depression in the surface of the right atrium, a remnant from a structure known as the foramen ovale in the fetal heart that allows blood to flow directly from the right atrium into the left atrium. Normally, the foramen ovale seals at birth to become the fossa ovalis, although it is possible to have a patent foramen ovale, a foramen ovale that is allowing blood to move from the right atrium into the left atrium after birth, will make the heart pump less efficiently and can increase the risk for blood clotting